So in LASIK, what we do is we create a section, a little partial thickness section with one laser, and then we use our reshaping laser kind of 20% into the thickness of the cornea, then put that section we call flap back in place. Tried and true, 30 million people have had it. So SMILE's almost like, it's almost like endoscopic LASIK in that, you know, the regular LASIK procedure, we make a U-shaped affair about 2/3 the diameter of this cornea, lift that section up, it's still attached here, and then reshape, remove some tissue, the computerized pattern, to reshape the cornea and improve the vision. Then we put that flap back in place. So imagine that like just regular surgery. SMILE is endoscopic LASIK, if you will, and they use a particular laser to carve out a disc within that corneal tissue, kind of a third of the way down, and they carve a disc out, and then through that tiny incision, that disc is physically grabbed and removed. The end result is the cornea changes shape. The benefits of SMILE are, studies have shown there's less dryness, although dryness is not a terrible issue with LASIK. There's less of it with SMILE. And then some folks, either because of the work they do or their just natural concern, they're not comfortable with the idea of that flap being there, even though 30 million people doesn't bother folks. But some people are conceptually, or if they're in a profession or hobby where they could get the eye hurt, like special forces or martial arts, you know, MMA fighters, they may not want that flap there. So SMILE achieves what LASIK does without the flap, fast vision recovery, safe and effective for patients. So when you come in, we may say we think LASIK's the best procedure, or in some cases we may say for your situation, SMILE may be a better procedure. And in other cases even, PRK or advanced surface ablation may be a better procedure.